For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Thank you, everybody. Give a brief presentation, and I just want to first, on the outset, make a comment. We have just been overwhelmed by the generosity of spirit, the number of applications that came in from an announcement we had less than 24 hours ago. We mentioned in the state of California, in order to surge our system by roughly 2/3, we needed three things. We need the physical space, we need the appropriate level of supplies, PPEs, ventilators, but the most important precious resource is people. And we had a call to people all across the state of California, people whose license had expired, people that are retirees, people that are in the profession but haven't finished their licensing requirements, be it nursing schools or medical schools. Remarkably, over 25,000 people already have filled out applications on our healthcorps.ca.gov website. Over 25 licensed Californians, phlebotomists, radiologists, EMTs, doctors, nurses. A remarkable spirit and a remarkable number of individuals that stepped up and are willing to step in to meet COVID-19 head on. So I want to just begin my comments by thanking all 25,000, and those of you that are out there that have the kind of expertise, that may have retired recently or are looking to get their license renewed, please check out the healthcorps.ca.gov website and contribute your time in a compensated manner to meet this moment. We're also getting a lot of questions at this moment about masks, not just N95 masks, not just surgical masks, not just masks for our frontline employees, particularly our healthcare professionals, but people that are in the grocery stores wondering if they should have a mask, people walking the streets, walking their dog, going to do essential business in the state of California, whether it's appropriate for them, whether it's advisable for them to have face coverings. We've been processing this over the course of the last number of days. There's a number of viral videos that are filling up my inbox. I imagine many of you watching as well, Czechoslovakia and other parts of the globe that have moved aggressively to advance protocols on face masks or other kinds of face shields and the like. We have a team that is considering guidance in this space to make recommendations whether or not we think this is appropriate. But let me caution on this topic a number of things. We are in real need of traditionally, surgical masks and these N95 masks. We are out there sourcing them from all around the globe. We have distributed some 32.4 million N95 masks to date, 32.4 million N95 masks, but we have ordered over 100 million of these masks. We need 100+ million N95 masks just to meet the needs within our healthcare delivery system. The concern we have when we talk about face coverings in masks is people run to get the N95s or they run to get the surgical masks, of which we are procuring tens of millions of surgical masks at the same time. And so we want to be cautious in this space. We want to be guided by science, and I'll just say this respectfully, science is a bit incomplete in this space. A lot of people are promoting face coverings and masks. Others caution that it is not a substitute for physical distancing, which it is not, and that it could create a sense that it is and may reduce the protocols that have worked so effectively so far here in the state of California. But know that we are looking to put out guidance on this. We'll put out our recommendations in short order as it relates to face coverings, and those recommendations will include the principal obligation we all have to continue our physical distancing, our social distancing, to wash our hands, and if we are putting face coverings on, we'll lay out guidelines in specific terms of what that means and what it doesn't mean. The last thing we want are people putting on coverings and moving them in their hands, not washing their hands, and potentially creating additional issues, people getting the wrong kind of impression that somehow now they're absolutely immune from contracting the virus and the like. But I know that this is becoming a major issue all across the United States. CDC has implied they'll be putting out some guidelines. I know the President himself and others have made reference to the same. We get this question all the time. When you go to a grocery store, people are trying to practice appropriate physical distancing. You feel like you're not necessarily capable of doing that in a short queue. The appropriateness of having these masks or a version of face covering. We recognize that anxiety, and we want to meet that in terms of recommending specific strategies. And so expect in the next 24 or so hours that the state of California will put out more prescriptive guidelines in that space. We also are very proud here in California. We had incredible leadership that is demonstrable in the state by Cesar Chavez. That leadership was recognized formally as this day is every year, Cesar Chavez Day. And in the spirit of contribution, in the spirit of service, in the spirit of meeting this moment, we are also announcing an effort to do more and do better to protect our seniors in the state of California. We have 5.3 million Californians that are 65 years and older. And we've been doing some remarkable things at the local level to check in on our seniors, wellness checks to make sure they're getting their medications, making sure they're getting their prescriptions. But we need to step things up significantly. And that's what we are announcing here today, a statewide initiative, working with our partners at the AARP, working with our partners at Alzheimer's, American Lung Association, Cancer Association, Heart Association, working with our local partners, our CERT teams that are part of our mutual aid program, traditionally utilized in preparation for our wildfire seasons, our Listos program, which we rolled out a few months ago to do the same. We're now reconstituting all of those programs and building capacity and partnership to significantly increase our connectivity to our seniors, to check in not just for wellness checks related to food and medicine, but the deep anxiety people are feeling being isolated at home, and the loneliness people are feeling at home, not connected to the outside world, anxious about their life and their loved one's life. And so neighbor by neighbor, we're asking people to make 5 calls. We've worked in social media platforms next door to do just that in 22,000 neighborhoods across the state. We've already connected through that platform just shy of 8 million individuals, but we have to go deeper and we have to do more. And we have to do it in a way that not only just checks in on someone to see how they're feeling, but be able to deliver something on the back end, not just a meal or medical supplies. And that's why we've created a hotline for people across the state that will guide them to more substantively deliver on the needs of the individual they're contacting. And that site has a following number, 833-544-2374, 833-544-2374. That hotline will allow individuals to be able to get questions they may have answered in ways that they can individually participate in helping support this moment in the spirit of civic contribution, in the spirit of the commonwealth, in the spirit that defines this moment, that we're all bound, as Dr. King said, bound together by a web of mutuality. And that commonwealth, it is incumbent upon us to check in on the greatest generation. People have brought us the world's most vibrant middle class and obviously have done so much for all of us. We have a unique obligation to do more for them. But in that spirit, to be able to do more, we need not just that one point of contact, that one hotline. We need to be able to drill down in a more substantive way. And so we've partnered with our 211 system. Our 211 system is an incredible system in the state of California that connects people to real services in real time. So if a loved one or a neighbor or a stranger is in need, and they need something more than just nice words and just a check-in, but need specific services. We've partnered now with 211 to provide those services at the local level all throughout the state of California. I'm going to have a representative here in a moment from 211 speak more about their robust system and what it provides. But I think this is a real opportunity for Californians to check in on the most vulnerable Californians and do so in a way that only Californians can. We'll elevate in that context the spirit, sense of pride that I think we all have at this moment. But let's do so in a way that's meaningful and substantive. And in that stead, I want to ask Richard to come up, who runs the local 211 system up here in Sacramento, to talk about the substance behind what that call center and those three numbers, 211, truly represent and will represent to potentially millions of Californians if we avail and take advantage of that system. Richard?
Thank you, Governor, and thank you to your teams also for the leadership that you're providing in these unprecedented times. I'm the board chair of 211 California and the local operator of 211 Sacramento. And 211 is really a 3-digit dial that makes it easy for our community members to get services at a very local level. Our call centers are staffed 24 hours a day, 365 days a year, and they're trained professionals on the other end of that line that will be there to assist you in doing some case management and getting you to the most fundamental needs. Together, we can work together as a community to start building those resources in those databases to ensure that the community members are getting access to services. Our call specialists are all trained in AIRS taxonomy, which means that they can help sort of provide guidance and determine what those unmet needs are. The 211s are operated by local nonprofits, and we're excited to be part of this program with the state, and we look forward to serving everybody soon.
Thank you, Richard. And I really encourage people, check in on your neighbors, make those phone calls, not just loved ones. Check in on strangers. People ask every day, what more can I do? Let's activate this kind of civic contribution. Let's activate this kind of resolve in real time in the spirit of Cesar Chavez, in the spirit of service, in the spirit of real contribution to help meet this moment. Let me thank our entire team for putting together this comprehensive overlay to really increase connections and increase our obligation to our seniors throughout the state of California. Let me as well just update all of you on the latest numbers in the state as it relates to the number of positives, 6,932, number of deaths, tragically 150 in the state of California, the number of hospitalized individuals with COVID-19 and the number of people on ICUs. We have 1,617 people currently hospitalized with COVID-19, and we have 657 individuals that are in the ICU. Those numbers represent a 17% increase in the total number of positives in the state. The number of hospitalized represents a 13% increase over yesterday and a 10% increase in the terms of the number of ICU patients in the state versus yesterday. I should note, if you roll a 5-day average, again, we have seen more than a doubling the number of people hospitalized in the state over the last 5 days, and now more than triple the number of people in our ICUs, reinforcing the importance of preparation in meeting this moment. In terms of the preparation, I mentioned the incredible response yesterday. Again, 25,000 people strong through healthcore.ca.gov. Again, licensed individuals. These weren't just people randomly checking in and welcoming themselves to a website and looking at it. These are people filled out forms with their specific license number, and they're ready to contribute. And we're triaging every single one of those individuals and looking at the geographic distribution so we can meet the moment, because we recognize in California we're many parts but one body, and different parts of the state have different needs. And so we're looking at the geographic disbursement of the individuals that are willing to participate in making sure that we are appropriating our surge capacity from a bottom-up perspective. By the way, I just want to thank again Facebook for their $25 million contribution to help with stipends for those same individuals, for accommodations in hotels so they're closer to patients, for transportation, and for child care. Many of them need child care at this moment, and those dollars are now readily available for individuals that wish to contribute to this moment, in addition to the ongoing support we'll provide from a salaried perspective. This is not a volunteer effort. Healthcare or healthcore.ca.gov. It is fully reimbursed beyond, again, the stipends that will be provided through the private sector. We in the state continue to do more to find respirators and ventilators. Let me specifically talk about ventilators. You've heard me say in the past the number of ventilators that we've identified in this state, 4,252. 2,000 of those being purchased through our Department of General Services from overseas, from China, the rest in hand. With that, we have a call out to get another 5,000+ ventilators. Our goal is about 10,000 ventilators. We have requests in from the federal government, national stockpile, and we have requests out from all across the globe. But one of the most spectacular responses, and I don't say that lightly, and I don't say that without consideration because I don't want to express hyperbole, but I cannot impress upon you more how pleased I was to get a call back from Virgin Orbit. These are the folks that make rocket engines, launching systems. They're here in the state of California, down in southern part of the state, down in Long Beach area. They met the call and now already in action, prototyping respirators that are not as nuanced and comprehensive as the respirators, or rather the ventilators that so many of us are speaking of. These are less complex but can meet the moment and are more readily available. They're bringing up a prototype in the next 48 hours right here at the State Operations Center, and they're already running additional prototypes to help not just the state of California, but to potentially help other parts of the country. I say that because they deserve credit for being willing to reprioritize their production efforts down there and look at meeting us where we need most support, and that's through the ventilator side of the procurement. And so thank you to Virgin Orbit. Thank you to their team down there. It's, again, part of the ingenuity, part of the entrepreneurial spirit that defines the best of California and Californians. Again, that was exampled this weekend by Bloom Energy that converted all of those 150+ ventilators that were down from the national stockpile down in LA County and refurbished them, and have already sent them back down into LA County. Again, spirit of meeting the moment, taking responsibility, taking into account that we have more that we can do than we even believe, that our mind needs to be stretched at this moment, and it is being, in terms of civic contribution, in terms of people, the private sector stepping up in ways that really do justice to what makes this great state what it is today. So that's broad strokes an update. I'll just close with one additional update, and that is census. We have to fill out those census forms. Many of you are at home appropriately. Fill out the forms. Send the census forms in. Tomorrow launches our census process. It ends December 31st. We may need to get that extended. That's another conversation. But please fill out your census forms. That's about representation. That's about remuneration. It's about appropriately getting supported from the federal government and making sure that our state gets its fair share. And we don't get that unless you fill out those forms. And obviously, the census process and protocols have changed since COVID-19, but that doesn't mean we're not going to be aggressive in sourcing as much as we can in terms of people's contribution. I will forgive me, one additional final point. I signed an executive order yesterday that we refer to as an omnibus executive order. Don't mean to confuse people, except to say it had a lot in it. But one of the things it had in it is very important to small businesses, and that's a 90-day extension. If you're a small business person, you have a 90-day extension on paying your sales taxes to the state. We also have license extensions, fee extensions that were also part of this package. As a former small business person myself, this I hope comes as welcome news. We continue to want to do more on commercial evictions. We now have 8 counties, a number of local cities that have done moratorium. We are continuing to work on that, as I've mentioned in the last few press conferences. More on that when we're ready to announce. But no, the small businesses are in our heart and mind, and we continue to do more. And I'll speak before I open it up to questions about more. We had a record number of people filing for unemployment insurance yesterday, over 150,000. So now it's well over 1.6 million Californians. So we all recognize we're going to have to do more to meet this moment for employees and employers and process this moment, get through it, and then get this economy back and growing as it was just a few months ago. So happy now to take any questions.
Jeremy White, Politico. Jeremy White, Politico.
Hear me?
Jeremy, we can
Hello?
hear you.
Can you hear me?
Yes.
Can you hear me?
Yes.
Hello? Okay.
Perfect.
Hey,
Thanks.
sorry about that.
Okay.
Thanks as always, Governor.
Thanks,
You
sir.
mentioned what the state is doing to procure enough ventilators and respirators. A week ago, you expressed some concern that California's large purchasing power there could work to the disadvantage of other states. Today, the governor of New York, Andrew Cuomo, said it's basically like eBay with other states, including California, essentially bidding one another up. And so I'm curious to know, to what extent is that a concern that California's purchasing power is coming at the expense of other states? And do you see a solution in which there's a more centralized federal effort, or in which California releases some of that equipment to other states that are in a dire need?
Yeah, not only a week ago did we express concern about this, we did something about it. We reached out to Governor Jay Inslee, Governor Pritzker, a number of other governors, and said, let's connect our procurement teams together to make sure that we're going and working together. Governor Murphy and I, a few weeks back, had a similar conversation. So you're starting to see these partnerships at the gubernatorial level, at the state level, to help centralize. Look, I made a point that we have purchase order out for 101 million N95 masks. That, I hope, puts our purchasing power in perspective. That is a substantial amount of money that this state is capable of committing ourselves to, that not all states can. We also are working with our FEMA regional director, who happens to live out here and happens to spend a disproportionate amount of time here at our State Operations Center. And we're very sober with Bob Fenton in conversations about what other states need as it relates to even what's coming from the national stockpile, and making sure that none of us are being greedy at this moment, and that we have the capacity to move things around. And so that's the spirit, to answer your question, that we're bringing to this conversation and debate. We are, as a nation state, de facto a centralized purchaser of incredible capacity, but we want to help other states, even as large as Illinois and Washington State, some of the largest states in our nation, to see if we can help procure not only a reduction in costs per unit, but also procure a mindset where we're not playing in the margins of a zero sum, where it's us versus them.
Carlos Granda, KABC.
Hello, Governor. The state of New York was concerned last week that the hospitalizations could double every 2 days. Today you said that here, at least for now, they're doubling every 5 days. Does that show that our numbers, are they moving in a good direction at least? Do you see some positive signs?
Yeah, no, I mean, we're seeing an increase, and those increases that I referenced as it relates to ICU beds, not just hospitalizations that have tripled in ICU, doubled in our hospitals for COVID positive patients. That was not an insignificant increase from what we had seen in previous weeks. Look, the number of positives today at 17%, the number of hospitalization, the percentage increase, when I'm now looking at the percentage of 13%, ICU 10%, that is in line with some of our modeling, but no question, we are not out of the woods yet. By no stretch of the imagination should people think that California is overly confident at all. We are continuing to procure the PPE, continuing to get the human resources that I spoke of at the top of this hour to continue to meet the surge capacity, not just the USNS Mercy, but now we have identified all 8 field medical stations and their sites from Shasta to Butte County to San Diego to Contra Costa County to Riverside to San Mateo County to Santa Clara and LA County. That's 2,000 bed capacity. We'll get the National Guard building those out, working with the Army Corps of Engineers. I said yesterday they had already had 19 site inspections. They're up to 24 now, and we'll be making some announcements about partnerships with them in the coming days. We're doing all of that because we're not out of the woods. We're doing all of that because we have the time to prepare. And that was the whole point of moving early on physical distancing. There is no regrets in the state of California on our protocols on physical distancing. The only regret we will have if people cut the parachute before they land. The only regret we will have if we prolong this is that we didn't take it seriously and we didn't recognize some of the early signs of success. But success is defined by buying us time to prepare. The announcement today on seniors was about preparing. I don't want you to be writing headlines, and I don't want to be hearing stories that someone finally knocked on a door and no one answered, only to find out when they opened that door that someone had passed away because we didn't meet the moment. And that's why we are building this capacity at every level of government, physical and human capacity. And so, yes, we are starting to see increases. Yes, that's consistent with our model. And yes, we are doubling down on our preparedness and our admonition to everyone, young and old, to continue their physical distancing.
Jeff Fowler, Washington Post.
Hi, Governor. Thanks for taking the question. Just sort of playing off what you were just talking about, the Bay Area in Northern California was the first in the nation to have that shelter-in-place order. So now that it's been 14 days, do you see evidence that it's a model for other U.S. cities, that social distancing orders work? And, you know, the Bay Area was also ahead of Los Angeles in that order. Do you see in your models a difference between the Bay Area and L.A.?
I think we have to be cautious in this space. I mean, you certainly can look at the numbers and you can jump to that conclusion, but all the experts around me want us to be cautious in terms of jumping to conclusions. It's still just too early to tell. I couldn't be more proud of the leadership within the San Francisco Bay region, but the leadership in Los Angeles is demonstrable as well. Mayor Garcetti was quick to move in this direction. So was the county. They all supported the stay at home for 65 and older, our seniors, which predated even those local announcements, and they began their preparations very, very early. So I think it's a sum total of all of these parts. But again, talk to me when we're doing our post-analysis, our post-action reporting. We are taking nothing for granted in this state, and we are doing everything we can to take advantage of these moments, not only to increase our surge capacity, but to continue to promote the slack within our hospital system that we have been able to advance by reducing the census, by eliminating those elected surgeries weeks ago in many instances, that are providing bed capacity that wouldn't even exist outside a COVID-19 epidemic.
Phil Willen, LA Times.
Governor, hi. I hope you're doing well.
Thanks, Phil.
This morning at the San Mateo County Board of Supervisors meeting, officials there expressed grave concern about the lack of PPE at Sinton Medical Center and also the need for more staffing. Just want to find out what the state is doing to address those needs.
Yeah, well, look, as you know, we brought Seton online. They have the capacity to go up to 220 rooms. They're not there yet for two reasons, the two you just brought up, staffing and PPE. So we're working to get that staffed up, as we are, Phil, it's relevant to you as the LA Times reporter, St. Vincent, and we're making real progress there, which we hope to announce in the coming days on staffing and PPE. I made the point, we have $100+ million N95 masks alone. That's not the coveralls, that's not the shields, that's not the gowns, that's not the glove sets, that's not the surgical masks. That's just a proxy for PPE writ large. The magnitude of 100+ million mask order gives you a sense of the magnitude of the anxiety at the local level about the need. And so we need to do more, and that includes San Mateo County, includes every county, candidly, in this state. And we are in real time. As soon as it comes in, we are getting it out. And now that includes making sure we pre-position our ventilators that are being refurbished, not only in the state cache, but also those ventilators that came from the federal cache, and making sure that they're geographically pre-positioned so that we don't get more questions like yours, which is completely legitimate and recognizable because it's amplified by hospitals, not just systems and counties throughout the state.
Christine May-Duck, Wall Street Journal.
Thanks for taking our questions, Governor. I appreciate it. You talked a little bit about the modeling and how, the state's increase in numbers recently has kind of matched their modeling. There's modeling coming out of the University of Washington researchers as well that has demonstrated that California so far is starting to flatten the curve that they had expected initially last week, that the total number of deaths in California could be in the 6,000 range. Now it's down to the 4,000 range. Does that match the modeling that the state has been doing? And we also wanted to know, how early you and others in the state looked at modeling and how that played into your decisions early on to do social distancing measures.
Well, we leaned in on the modeling very aggressively and generated a little controversy around putting out numbers in a very forthright manner that generated some headlines and some anxiety, but it was a proof point of our modeling protocols and practices. I mentioned at the time that we had early on, before we even socialized publicly, began our modeling protocols using not just our traditional health system modeling, but supplementing it with geographic movement and information that's publicly available from companies like Facebook and Google and others, working with Esri, working with Blue Dot, and looking at travel propensity within populations within the state, and running models along those lines before we socialized the quote-unquote attack rate that we did. That modeling is iterative. That modeling is constantly being reviewed, updated. We got John Hopkins numbers that we overlaid, obviously, with the anxiety that we all had around what was happening in Italy. We had updated our modeling in real time a week or two ago around issues that were self-evident in Spain, not just Italy, and other parts of the globe. But I will say this, to be truthful and candid, the current modeling is on the lower end of our projection as I talk to you today. Very easily tomorrow, I could say something differently. And that's why just one has to be very cautious about this. We run best case, worst case, and a likely case. But it assumes the most important piece, not AI, not big data, not just mortality rates, hospitalization, and ICU rates from other parts of the state or around the globe. It is absolutely required of individuals to make the determination themselves of what those models look like through individual decisions. And modeling means nothing if individuals don't continue to practice physical distancing, social distancing, and continue to do the right thing at the stay-at-home order. That is the most profound and impactful part of bending the curve. And I think because Californians have done such, I think to date, an exceptional job of meeting this moment, and we see that in the data of movement that we have throughout the state, not just anecdotal as you walk or drive around, but we continue that practice, then I think we can meet this moment. But again, these numbers are dynamic. And a week ago, we were not anticipating necessarily a tripling in a few days, the ICU beds. We saw a 10% reduction, or down 10% increase, forgive me, yesterday, but it just shows you the dynamic nature. But I think it's well within our current projections. But I caution how we report those.
Kathleen Renane, AP.
Hi, Governor. I just want to understand a little bit more your comments yesterday that our peak is probably going to be in mid-May and how that peak relates to our hospital capacity. So you've talked about a surge capacity need for 50,000 additional hospital beds. So under our modeling, when we hit our peak, are all of those beds filled up? When we hit our peak, is that when we start needing those surge beds? How does the peak kind of match with our available hospital beds?
So first, thank you for bringing up the 50,000 number. And I'll remind folks and folks that haven't been watching prior, the 50,000 number is phase one. When we launched the 50,000 number, when we made that public, 75,000 beds licensed within the existing 416 hospitals. The 50,000 phase one surged to 125,000 rooms that we are looking to procure, of which 30,000 would be done within the hospital system, a 40% surge for the hospitals, and then the rest would come from the state. That was phase one. As it relates to our modeling, that is true. People are talking a lot about when's peak. I saw a headline today, someone saying peak in the country maybe April 15th. That does not reflect California's reality based on our modeling today. We expect that peak, as you suggest, as was mentioned by Dr. Galley yesterday, more likely in May. There is a worst case scenario, phase two of our planning that we are working on with our Office of Emergency Services, Mark Gilladucci and others, working with the Army Corps of Engineers, working with our teams here that have capacity that's substantially greater than 50,000. Let me be specific. You heard from me a few weeks ago. I talked about the conversations we had with Janet Napolitano and Tim White at the UC system and the CSU system. Both systems have identified over 5,000 beds, respectfully. As an example, that would be phase two. We've already identified a number of hotel opportunities beyond those that we're making available for our homeless, which would also be part of that second phase. We are working with the Army Corps of Engineers to look well beyond what we've already communicated, be it the Sleep Train Arena or Oakland Coliseum. We're also looking at LA Forum and other places that would be part of that extended phase. So I hope that gives you some deeper clarification, and we're happy to have Dr. Galley flesh more of that out tomorrow and the next day. But I feel very confident in our current modeling and that 50,000 number for phase one.
Tiffany Stecker, Bloomberg.
Yes, thanks, Governor. I had a question regarding your executive order yesterday in the health corps. Do you foresee at any point having to bring in healthcare professionals from out of state, perhaps states that are less affected by the virus?
You know, I'll be honest with you. If you asked me that this time yesterday, I may have said yes. We were overwhelmed. I don't want to be hyperbolic about this. I don't want to be accused of overstating, but 25,000 people with licenses that filled out the application, that went through that 5-step process, that said, you know what, we're ready to step up. That was extraordinary in less than 24 hours. So the answer today is no, today. We'll vet all those 25,000. I'm not naive. Not everyone is going to fit a need particular, maybe too many folks that are expert anesthesiologists. We don't need as many, too many EMTs, too many pharmacists, too many nurses, too many, who knows? But I feel like based on the spirit that I've seen the last few days, that we can meet this moment domestically within the state. And to the extent we have capacity beyond that, we're going to make ourselves available to anybody across this country that needs support as well.
Marissa Kendall, Bay Area News Group.
Hi. I was wondering, we've had several coronavirus infections reported here in the Bay Area among local grocery store workers. Yeah. And I was wondering if the state was doing anything to ensure the safety of those folks who work in essential fields like grocery stores and still have to go to work, and prevent them from getting infected, as well as infecting the customers who need those services.
I appreciate the question. I mentioned a couple of days ago on deserves to be restated. Close friend of mine, John Grant, who runs one of the largest grocery unions in the United States, UFCW, here in the state of California. John called me very emotional about the loss of a life of one of his members and said, "You need to be reminded, Governor, that the grocery lines are also the front lines of this virus. And my members are showing up to work not on the unemployment line. They're volunteering themselves, and they're quite literally now putting their lives on the line to make sure that they meet the essential needs of Californians all up and down this state." And there was a frame of heroism in his recognition of his members, and I think it deserves to be socialized with the rest of us. These folks are putting their health at risk, and they are meeting the moment. And to answer your question specifically, we need to do more for them. And we haven't done as much as we need to do for them to provide them the kind of breaks that they need to wash their hands, to provide the kind of support they need to get protective gear, and to make sure that they're safe and healthy. And I want you to know that I don't just identify a problem, we're trying to solve that problem in real time. And we're working with the grocers, representative associations, and the unions to see if we can accommodate more appropriate safety measures for those grocers that you rightly recognize deserve our respect and in some case reverence.
Felix Michelson, Fox 11.
Thank you, Governor. Alex Michelson here. Big picture question about you. This has got to be the biggest leadership test of your life. I'm wondering, how are you doing right now? And also, to that point, to see the extraordinary, as you mentioned, 25,000 Californians coming forward and all the different Californians coming in all different businesses and everything that they're doing, what you make of the way that California is responding to this and what the rest of the country can learn from what California is doing.
There's an energy all across this country, and there's extraordinary leadership with governors of large states, small states, all across this country. They all deserve incredible credit for meeting this moment. But there's something I talk a lot about, Alex, and you know this. I talk about the issue of difference between people in formal positions of authority and people that every day exercise their moral authority. Today we're celebrating the life and times of Cesar Chavez, not the former governor of California, but one of the world's great leaders, happened to be from California and led the work to organize the farm workers and have provided so much bounty that so many of us take for granted. What he had was moral authority. And leadership, I'm discovering at this moment, can be found everywhere. Individuals every day leading a cause at a church. And by the way, the churches are stepping up to reach out to our seniors. A leader in a school, I saw a DIY or DIY, do-it-yourself model that came out of a local high school of how to do shields. No one asked that young girl to do that. They just put themselves on the line. That's leadership. So I'm just one of many in this state, one of millions, I think, of leaders that are discovering their own capacity and their unique capacity to meet this moment. I'm inspired. You want to ask how I'm doing? I'm inspired. I've never been more damn inspired in my life. To see that number, just 25,000 yesterday alone of professionals that are willing to come out of retirement to put their lives back on the line, knowing that the PPE may not be there when they go back out onto the field or onto the hospital room, into the hospital room. That makes me sleep well at night. And so thanks for asking. No one asked that question. I appreciate it. But no, when you have the privilege that I do of representing the state, that will enliven your senses and distill a sense of well-being that makes me feel very, very good about this moment.
Final question, Ben Christopher, Cal Matters.
Thanks again for taking the time, as always. Kind of a policy-making question. So given that we're now almost in April, at this point, do you see a need for any changes to the legislative calendar? And do you think the legislature should start preparing to legislate remotely in order to either meet the June budget deadline or to pass any other urgent legislation? And also start to double up, but if you could also just provide an update on your meeting with the county superintendents and how the state is doing to make sure that kids are getting educated across the state. I appreciate that too. Thanks.
Thank you for both questions. I had a wonderful call today with the leaders of both the Assembly and the Senate, Tony Atkins, the Senate, Speaker Rendon. We had precisely this conversation in reference to your question of what we expect, what we need in terms of the calendar, what the members expect, what they need. And so all I can say is that's fluid. There is no time certain to come back in session. They have been extraordinary. I cannot say more about both leaders, and the members have been incredibly accommodating and patient under this very difficult circumstance. So I don't have an update for you in that space except to say it's their house is, legislative branch, and we will support them and accommodate them, but they're being incredibly deferential to the experts, our health experts, and the needs of their membership in communities all up and down the state, and we're all trying in real time to accommodate their needs and ultimately accommodate that calendar. I have no expectation we won't meet the fundamental urgent tasks at hand as it relates to the budget well before those deadlines. And as you know, with a lot of these EOs, we're extending deadlines across the board to accommodate for all kinds of other realities that are parcel of the COVID crisis. So it relates to the schools. Let me just say this, and I don't mean, particularly it's the last question, to leave you wanting, but I want to be specific. We've been having conversations with the superintendent of public education. He led the call yesterday with all 58 county superintendents, talking about the issues of congregate meals, talking about distance learning, talking about what's working, talking about what's not. But he also talked about the calendar. He talked about the summer coming upon us. He talked not just about the calendar this spring, but the fall calendar. Talked about how people in communities large and small, districts large and small, have different dates of expectation when they may or may not come back. We are working together to go together to formalize a much more robust framework. And so I'm going to leave you with that expectation. And forgive me, I know I'm going to leave you wanting, that we need to be more precise. There's 73 districts, I can be precise in that respect, that are providing congregate meals. We are working in real time on best practices and distance learning. And by the way, governors across the country are working off our guidelines on distant learning. And I'm very proud of that because of the good work of the superintendent and Linda Darling-Hammond. But we have more work to do, internet connection, rural issues, and still trying to address the anxiety of parents like me and my wife and millions of others about whether or not kids are going to go back to school this calendar year or not. I have been clear in my belief they will not. But let me announce formally what the superintendent of public education believes and the superintendents believe, and expect that announcement in the next day or two. Let me thank everybody for, once again, their patience, their participation, and more than anything else, very briefly, let me just thank all of the Californians that may be watching, that you continue to do the extraordinary and heroic work that you've done to keep people safe, keep people alive, continue to make the individual decisions that in the aggregate are going to, I think, exceed expectations and meet this moment. Practice physical distancing. We'll get you guidelines and clarity on these facial coverings. We'll do more to give you clarity in the next day or two on the schools. And again, I just want to express deep appreciation and gratitude to millions of Californians. And let's continue to stay the course. Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.